You were talking about setting up some kind of a mentorship program.
Yeah.
What would this entail, and how would it help?
Well, I mean, when I think about what aspects of the whole process with the machine, what has been most helpful to me, individuals like yourself stand out. That there's been mentorship along the way from different support groups and recovery groups, people I've met along the way sort of by chance. But it made me think, what if there was a more formal version of mentorship where you were connected with someone with lived experience who had been through the whole process, ideally of the same career as yourself, who could be a person to bounce not only feelings and ideas and thoughts off of, but also what was happening in the process. And this person could then be a bit of a partner for you, and maybe even at times be a bit of an advocate, even if it was just through figuring out how to approach a meeting or how to approach an appointment, say.
Mm-hmm.
And I mean, I know that for folks who do 12 steps, sponsorship is such a big thing. And what one of the biggest take homes for individuals is what they get from their sponsors and that relationship. Things like Smart Recovery don't do sponsors, but you still develop relationships with people, and you still find people whose help is a benefit, and you kind of they are seeing you through and going through the journey with you a little bit as they hear your story. So I don't know. That was my thought about how to kind of make that not an exception, but make that a rule, and something that the whole system, the whole machine saw value in, and said, okay, we know you're going to be going through something where you're pulled in 5 different directions. We know you're going to feel isolated and alone. Here are some people that we think might be a good fit for you.
Yeah. I can tell you that one of the first thoughts that came to my mind when it was the college had basically contacted me to let me know that they had suspended my license. It was it was early on. I was completely ignorant as to what was going to happen to me. And at that point, I asked the what do they call them? Complaints officers, I guess. I asked if I could talk to another pharmacist who'd been through this. Mm-hmm. You guys must have seen other pharmacists go through these circumstances. Is there any way you could put me in touch with one of them? I would love to talk to somebody so I could wrap my head around, what's gonna happen, and maybe give you some tips, and just make me feel like I'm not the only person on earth that this has happened to. And the response was, no, we can't do that, and because the generic confidentiality thing. But I can tell you that I felt like that would have been, if there was one thing I wanted, more than anything else at that time, if there was one source of help, it wouldn't have been like a doctor, a professional psychiatrist, or whatever. It would have been that pharmacist who'd been through what I'd been through and made it out the other side.
Yeah.
That was what I was looking for. So this idea of having a program set up where people were, I don't know how it would work financially, because, in the 12-step program with the sponsors, their idea is that the sponsor is getting something out of the deal by helping another person. I understand that. However, I think there's when you've got a healthcare professional that's, maybe already, their time is already quite valuable. If you want to be able to, actually have a schedule that's agreed upon, and so that you've got their ear for it could be 20 minutes a week, who knows, but just a little bit of connection with a person like that I think it would give the individual at the beginning they'd be in a better position to take advantage of treatment that, they'd know going in they'd have an idea of what they're up against, what they should pay attention to, what they should maybe take with a grain of salt, what worked for that person. And it's not going to be a situation where the mentor is going to just lay it out for them and tell them exactly what they're going to do.
No.
It's more that the individual is going to be able to ask that mentor questions, and they can provide the answers as best of their ability. And I think just having access to somebody like that, not only because they've got answers that you don't, but because there's another person who exists that you can connect to, because you're, at the beginning, I mean, they really make you feel like you are the only person who's ever had a problem with drugs that's a healthcare professional,
For sure. And there's a long lag time between services kicking in and appointment dates coming up.
Mm-hmm.
So you will be off work for maybe a month, maybe 2 months before your first appointment. Maybe you're waiting another couple of months for treatment, maybe less, but the treatment doesn't, at least for outpatient treatment, say it's not starting up every week. You have to wait for the intake. So those are really vulnerable times, and times where some connection and some mentorship would be really, really valuable. This business of leaving people to their own devices, like, what a terrible idea.
It's the worst.
Terrible idea. And I don't think that the leaving people to their own devices is malicious. I think it's just the system being bogged down. Every facet of the system has a heap of work that is coming from various directions. I don't think that they're thinking, let's let Nathan stew.
No, they're not thinking that.
But like, why let Nathan stew unnecessarily when what you were asking for was to be able to talk to another person who'd been through it? It's like, it seems like such an obvious one.
Mm-hmm. And I've since approached the College of Pharmacists about that again, offering my own services on the other side, and was again declined, which I find disturbing.
Yeah. Like the thought I had was, what if you went through the machine, you went through treatment, and then either your union, and I haven't kind of figured out which side to go, but either your union or your college, in the case of nurses, I think about the union, to say, are you willing to put your name on a registry or on a list where you could be called by an individual who's new at this? And if you say yes, great. And if you say no, then you can walk away and never have to receive a phone call if you didn't want to. Mm-hmm. But if that option was open, and if I had been asked, hey, would you like this? I would have jumped at it. And I think there's other individuals that would jump at that too. The opportunity to reach out to someone who, after they've been through it, and say, you're not alone.
Mm-hmm. Yeah. I mean, I can't help but be a little suspicious at the reluctance there. Well, like, why such a resistance to it?
Yeah.
I mean, it's not a confidentiality issue if both parties agree to it. I mean,
right.
Are you too lazy? Is it too much of a pain in the ass for you to just, all I was asking was that my name be available for other pharmacists who are in that position. Just have my name there. And if somebody asks that question that I asked, just give them a card. Is that too hard?
Yeah. And it leads one to assume that keeping people in the dark is of benefit to the system.
You can't help but think that. Yeah. And it's certainly you get the feel that each entity that's involved, it benefits from you being off balance for as long as possible, because it makes their job so much easier. Maybe, mm-hmm. When they're dealing with, somebody early on in the process, you're pliable, you're vulnerable, you're scared, you're willing to do, you feel like a piece of shit, like you're even beat up as far as your, I don't know, call it self-esteem. You don't feel, you're ashamed, and you want to make it better. So the last thing you're going to do is run in there and start advocating for yourself. So if you see some weird stuff, you're more likely to, oh, well, I guess I just don't know yet, or I'm sure these guys know what they're doing. And, that approach quickly devolves into a situation where you're like, what in the fuck is going on here? Like, this is completely insane.
And by 6 months into it or a year into it, you've got a chip on your shoulder, you've got an edge, you're aware of the dysfunction that is rampant through the system, and you are much more, maybe some of that shame has gone away, and you're much more willing to push back a little bit. And if they had a whole slew of healthcare professionals who were edgy and pushier, that would make their jobs a lot harder too.
It would. Yes, maybe it's just it's a control issue, and maybe it's maybe it's just like you say, a workload thing. I don't know. I'm going to think about that a little bit more, but I want to know, why, other organizations, like I've talked to the College of Dentistry in BC. They were very nice. They're like, yes, of course we can do that for you. That's, we appreciate you thinking about our members and blah, blah, blah. They were totally amicable, but not so with the pharmacists.
And I even think if individuals agreed that they would be a mentor, that there were some parameters there, and there could be discussion in advance about what that role entails.
Sure.
And if there wanted to be some discussion, that would be okay, because I think something would be better than nothing.
Yeah. Like, you mean, if you could sit down with, like, say, the college, if I would have went in there and said, I think this is a helpful thing for people going through this. I feel that way because I've been through it myself. And I wonder if maybe you guys would be more comfortable if we just set some limits on what could be discussed. Maybe they're concerned that there's going to be more legal ramifications. So maybe if a contract was drawn up as to, like, you're not going to take this pharmacist who's got in trouble and turn them into a fighting machine that's going to set the place on fire, something like that. Yeah, maybe that's what they're worried about. I don't know.